Today, we'll be discussing on ways to treat anxiety and depression using lifestyle changes. You know, the situation in the community is pretty grave. More and more people are being diagnosed with anxiety and depression. About 9% of people above 18 have been using antidepressants in the past 1 year. And this was taken from 2018 statistics. Figures released in 2020 shows that 650 people committed suicide. And this seems to be increasing every other year. And the highest suicide rate in the developed countries is New Zealand. This is 5 times higher than what you see in United Kingdom. And the number of patients using antidepressants seems to be increasing every year. And this is something that came in one of our newspapers. It says more young New Zealanders are using antidepressants. There was a research that was done from 2007 to 2016 by the universities of Auckland and Otago. And this shows that the rates of antidepressants being dispensed are at an all-time high among young people. And the biggest increase was in the 13 to 17-year-old. And this is alarming. You've got 83% rise over the past 9 years among this age group. You know, antidepressants, as helpful as they are, is what we think so far. It takes about 2 weeks to start to show any change. And the first week can be quite difficult with patients who take these medications feeling more suicidal with increased agitation. There are multiple adverse effects, and some of these you can see on your screen, with anxiety, feeling that they're shaky all over, feeling sick, having indigestion, diarrhea and constipation in some people, loss of appetite, dizziness, and also difficulty with sleep. There are many others like weight gain, dryness of the mouth. I've had patients who have come back who have been started on antidepressants with complaints of severe sweating. And of course, there are heart rhythm abnormalities that can develop. So there were studies that were done comparing the effects of those who are taking antidepressants and certain others who are given placebo, which means a sugar pill, as you would say. So antidepressants, as you know, are used to fix a chemical imbalance. And what they found that most, if not all, of the benefits of antidepressants in the treatment of depression and anxiety are due to the placebo response. Now, this is quite interesting. We've had some of our specialists stating that antidepressants don't work and doctors should help their patients carefully come off psychiatric drugs. And this was told by an international expert. This came out in the newspapers a couple of years ago. And then another expert said in one of the conferences they were having in Dunedin that antidepressants could heighten the risk of suicide. And we know that, but this is just being stressed that antidepressants alone may not be the solution. We also have psychiatrist and Otago University professor Roger Mulder 2 years ago had said that there was a report that was printed in the Lancet that antidepressants do help, but he says, no, that is not quite true. It's the drug companies you're making a huge amount of money by selling these medications. Now, whether this is totally true or not, whether antidepressants work or not, we all believe that we need to do more than just give patients their pills for depression. Lifestyle changes is known to help a lot in helping people with anxiety and depression. 2 weeks ago, if you remember, we had learned about how gut microbiome helps with immune system. And so we will just revise that. We have this New Start program, which uses nutrition, exercise, water, sunlight, temperance, air, rest, and trust, which helps people change their lifestyle. So what about nutrition? We learned about gut microbiome a few weeks ago. We learned that gut microbiome are the bacteria that is in your intestine, and they break down the fiber that you eat. And as you know, fiber is found only in plant-based foods. And when they break down the fiber, they produce chemicals, metabolites They produce cytokines, and if you remember, that was to do with the immune system, and also neuroactive molecules, neurotransmitters. So fiber, keep in mind, is really important so that your microbiome can work on it and produce these substances which can help with anxiety and depression. Now, one of the reasons people have poor nutritional status resulting in depression and anxiety is because people take a lot of junk food and also meat in the diet. There's low intake of fruits and vegetables. One of the reasons fruits and vegetables are really helpful to lift a person's mood is because the microbiome can work on the fiber that comes with it and produce chemicals which can uplift the mood. Refined foods like sugar, it gives a quick, happy feeling because of some of the chemicals that comes through it. It helps in the increased release of serotonin, which helps you feel temporarily better. But this doesn't last, and it goes down. And as the sugar levels in your blood go down, that brings in again anxiety and low mood. And the person obviously goes back for more sugar. And so sugar addiction, as you know, is a real thing. Nutrition is possibly the most overlooked cause of depression and anxiety. It takes about a week or so to begin noticing a difference once you've made a change in your lifestyle. And it keeps improving over the next 3 to 6 months. An antidepressant would take about 2 weeks before you can start seeing much of a change in your mood, if at all it happens. If it's a placebo effect, obviously you will start feeling better. Serotonin is a neurotransmitter that is required so that you can feel well in yourself. And lack of it, we know, causes anxiety, shakiness, trembling. You feel you're on edge, and you can see those symptoms on the slide there. People feel sad and empty, and a sense of I don't care. Now, to get tryptophan in your diet is necessary because it helps in the production of serotonin, which helps your mood, and melatonin. Melatonin helps you rest at night. It's for you to sleep. So these are some of the foods that are rich in tryptophan. And I've obviously put only the plant-based foods, and they're pretty rich in tryptophan, which is necessary to produce serotonin in your body. So you've got tofu. There are these seeds: pumpkin, sesame, sunflower seeds, walnuts. So nuts and grains are pretty good, and so also is tofu. Norepinephrine is another neurotransmitter, and lack of it will cause decrease in concentration, fatigue, a desire to sleep all the time, having brain fog, memory loss, and so on. So you get norepinephrine from tyrosine. That's where it is used to produce norepinephrine. And these are the foods that you can get tyrosine from. Folate again. The great sources of folate is black-eyed beans. I wonder how many of you have tried. It's a very, very delicious soup that you can make with black-eyed beans. And of course, you've got the spinach and okra. If you've never heard of okra, there are lots of lovely recipes. Check it out on Google. There is a wonderful website that I go to. It's called The Happy Pear, P-E-A-R. You can check that website out. Lovely recipes in there with these ingredients. So in a nutshell, if I were to tell you what to eat to get more vitamins and minerals and a lot of fiber going into you, we would say vegetables, fruits, nuts, and grains. That these are the best options you've got to get all the brain food you need to help you with your mood. Now, animal foods also have quite a bit of these goodies in them, but along with the animal food will come cholesterol and many other harmful agents that you don't want to take in. What about iron? If you have deficiency of iron, you will have apathy, depression, fatigue, loss of stamina, and so on. So many times when my patients come to me, and most of our GPs would do the same, you would check the blood as well just to make sure you're not having problems with your thyroid, you're not having problems with your iron levels and folate, B12, vitamin D, and so on. So where do you get iron? Now, some of you may think that iron, you need to have red meat, but that is not true. Plant-based diet has a lot of iron in it. and you can see the list up there. These is not an extensive list, but these are some of the good sources. So seaweed, soybeans, pumpkin seeds, all kinds of seeds and nuts are really good. Omega-3 is another topic that people talk about a lot, and again you'll find these are pretty rich in the different kinds of seeds that we can eat. Then what about fish and mercury? You know, many people talk about how fish is a really good source of omega-3, which is true. But along with that, if you were to take fish, there are high chances that your mercury levels will increase. In parts of US, they have been strongly recommended that pregnant women do not take fish because of the mercury levels, and also for little children. Now, this is what actually happens. You know, you have so much of industrialization all around the globe that you have waste products going up into the air and then coming down with the rain. And as it comes down, it pollutes the water bodies with mercury, and you have fish in the water that takes it. And the small fish is eaten by the bigger one and the bigger one. And finally, you have a lot of mercury accumulation in the fish that human beings consume. And this mercury, once it comes into us, it doesn't get easily sent out of the body, doesn't get removed. And as a result, we then start accumulating the mercury. And mercury is known to be neurotoxic. So these are some of the symptoms that you can find with unable to sleep, nervousness, hallucinations, issues with memory, anxiety, depression, and emotional instability. So if you want to have omega-3, fish is not a good option. Now, this is Dr. Nedley, and he has been conducting, and he's written books as well, on depression and anxiety. I would encourage you to keep in touch with us, because maybe someday we may have one of these programs here for you. He talks about the 10 hits, which basically means the 10 insults that your brain can experience. It could be because of genetics, and there's nothing much we can do about it. You may be born with DNA that is defective, which may result in you being more prone to be anxious and having depression. Developmental, as you know, as we grow up, we undergo so many experiences. And, you know, as children, people get abused, people get badly treated, or they go some very difficult situations. And that has a lasting impact. Now, this may be a bit more difficult to manage, and so keep in mind it could be a result of your upbringing. And of course, lifestyle is really important. You can change your lifestyle. You can't change your genetic or the past experiences, but definitely lifestyle can be changed. We talk about lifestyle, we talk in terms of food and how you go about your day, what you do, and so on. Circadian rhythm is your sleep-wake cycle, and this is something, again, you can make a change. So best is to sleep early and wake up early. If you're not having a good sleep through the night, you're obviously going to get up not quite feeling well. Addictions. I can tell you, so many of my patients who come in with anxiety and depression are addicted to some substance or the other, and some to multiple drugs and which they abuse. And because of that, we know things like marijuana and cocaine, alcohol, and also tobacco. These drugs do have an impact on the brain. And it is something that causes a huge damage. So when people stop taking marijuana or methamphetamine, it takes some time for them to start feeling better again, because each time they take an addictive substance, they get a high in their mood, and then it suddenly drops down as the effect wears off. The next time they take another dose of this addictive substance, their mood lifts up, but not to the initial level, and it drops further down. And so after a while, to feel normal and to feel well enough to do what they would want to do, they have to take the drug. And obviously this is addiction that goes on. So you have to break that cycle. The patient has to come off these addictive substances. That also includes tea and coffee, by the way. Nutrition. We just had a talk on nutrition. There's much more, but if you're interested to know more about nutrition, you're welcome to get in touch with us, and I'm happy to send you resources. What about toxins? So that's where we talked about mercury, which is one of the toxins you can accumulate. There could be social causes, stress and grief that a person may be experiencing. So that could result in anxiety and depression. Medical conditions like thyroid issue can result in mood disturbances as well. And frontal lobe. What Dr. Nedley talks about when he says frontal lobe issues is that the way you think. If you think negatively, you made that as a habit, then obviously everything around you will look like it's wrong. Yes, so we can train ourselves, perhaps with help from a doctor or a psychologist, to do a cognitive behavioral therapy. So cognitive behavioral therapy, also known as CBT, is pretty good to help you change the way you think, change the way you perceive things, and how you interpret things. So we did talk about how to improve our immune system. And when we did, we talked about nutrition, exercise, a New Start program. What about exercise? We are finding now that exercise, if it's done regularly, will have a huge impact on your mood. So simple things as going for a walk every day for about half an hour is great. Or going swimming is another way you can exercise. I'm not talking about going to the gym as such, but yes, the simplest thing you can do is walk. What about water? When you drink plenty of water every day, you are hydrated and your whole body is well flushed, removing toxins, which will also help in getting your mood right. You know, dehydration can cause headaches and low mood as well. Sunlight. We know vitamin D is very important, and light itself gives you a sense of well-being. We know that especially in the southern part of New Zealand, where I come from in Invercargill, we find that people have depression and anxiety issues more, rather depression more, during the winter months. Temperance, that has to do with addictions. We need to get rid of our addictions to have a well-balanced mind. Air, fresh air is so important. We did talk about negative ions in the air. We talked about forest bathing. We found through research done that those who do forest bathing or go out into environments which has a lot of plants around, waterfalls, sea, it helps in refreshing. Rest is so important. As we already talked, you need to sleep adequately. And trust. You know, friends, if we do not have a belief, we don't have something to fall back on, it becomes easier to fall into depression. Those who have spiritual connections seem to cope better. They have a community around them who believe the same, and they believe in a power who cares for them and is interested in their well-being. If you want peace, if you want a sense of well-being, if you want to have a positive attitude, then follow this pathway of New Start.